That's a good question. What are some contraindications? What are reasons not to have a colonoscopy? The first reason not to have a colonoscopy is if it's not going to help you. The purpose of having a colonoscopy is to prevent somebody from having colon cancer. And colon cancer is a disease that ultimately often kills. We do not recommend colonoscopies for people that have other life-threatening medical conditions for which they do not expect to live for more than 2 to 3 years. If you get up to a condition where you expect to live for about 5 years, then the benefit outweighs the risk. So if you have a severe heart condition and they say that you're not expected to live for 2 years, then treat your heart condition, take care of that, put off your colonoscopy. In that regard also, colon cancer develops very, very slowly. And so as you get older and these polyps develop so much slower, that if you're past the age of 85, we do not recommend that you have a colonoscopy for screening purposes whatsoever. And actually, if you've had a colonoscopy, because it takes so long for a cancer to develop, if you've had a colonoscopy that was clear, we do not recommend you having another one after the age of 75. So if you're 75 or older and you've had a colonoscopy before and had all your polyps removed, then you can quit being screened. If you're over 85, you don't need to have it for any reason. The other is you need to not have a colonoscopy if you have some medical condition that puts you at increased risk of complications. These are patients that are on blood thinners, patients that are on prednisone or corticosteroids, they're on anti-inflammatory medications, or if you're on chemotherapy medications. There are certain medications that reduce the patient's defense system against the kind of complications that can occur. And so those patients need to have a very thorough evaluation and determine very carefully individually what the risks and benefits are. For example, if you just recently had a case of what's called diverticulitis, sometimes people have pain down in the left lower quadrant and maybe even some fever and symptoms of irritation of the colon. That inflammation of the colon can continue for 4 to 6 weeks, and we often recommend those patients to wait until the diverticulitis or the inflammation has quieted down before it's safe to proceed with the colonoscopy. But by and large, almost all Americans are over the age of 50 are candidates for colonoscopy, and there are very few people for whom the colonoscopy is contraindicated. The elderly, the frail, people with other very serious medical conditions, people on certain medications. But 95+% of the population that are of the right age are good candidates for screening colonoscopy.